Good evening, everyone. Tonight I'll be speaking to you about your vagina. So I realize a lot of you don't use the word vagina very often. A lot of you don't think about your vagina very often. And many of you don't know the impact menopause has on your vagina. I know many of you don't even know what your vagina looks like. And I really recommend that's a good place to start, to know what your vagina looks like. I'm Dr. Daniela Steyn. I'm a medical doctor. I'm a professor at McMaster University, and I have a very big menopause clinic at the Oakville Hospital. So I work with vaginas all the time. That's what I do. I'm very passionate about vaginas. And for the majority of my patients who walk through our doors, there are two things for everyone between the age of 18 and 80 years of age that can significantly improve the quality of their life. It's good sleep and good sex. And that's what I want to talk to you tonight about. Because if you can improve the quality of your sleep and you can improve the quality of sex, you can very easily, for free, improve the quality of your life. So first we have to look at sex and how all the hormones that Dr. Judy spoke about really affect your vagina. Your vagina loves estrogen. Your vagina needs estrogen to be plump, to be moist, to be flexible, well lubricated. And you very correctly, thanks Dr. Judy, described menopause. So I'm going to take that out of my talk now that you exactly know what menopause is. When you go through that transition, and it's a very long period, that is where you have a decline in estrogen, it does cause the vagina to be thinner, to have less fat, to be less plump, and to be drier. That unfortunately does cause painful sex. 50% of women after the age of 50 years does experience painful sex. And of course you're going to stop having sex if it's painful. Only 5% of women do seek help with painful intercourse. So, I don't want you to be any of those people. So tonight I'm going to tell you what you can do to have less painful sex. I'm going to start by telling you about one of my patients. It's a real patient, so I'm going to give her a different name. Let's call her Heather. Heather is CFO of a very big company, and she had menopause at a very, very inconvenient time in her life. She was at the height of her career, and she would wake with several hot flashes during the night. She would wake several times, really being drenched in a pool of sweat. It would happen so often that it impacted her quality of sleep. It impacted her. She developed fatigue, chronic fatigue. She would have brain fog at work. She would have impaired concentration at work. She became very anxious, very irritable. And then if her husband mentioned about being intimate, she told me she would get so mad at him, she felt like punching him in the face. That's quite significant, and that's why she came to me. So I told her that I can help her, but I'm going to go through quite a lot of things tonight. If you don't remember them, everything is covered in my book. Thanks for all of you who did get copies of my book. Everything is in there. And I also have a lot of resources. I have a podcast and I have a YouTube channel with quite a lot of resources on my YouTube channel, talks specifically on menopause that you can have a look at. So I told Heather that sex was a big concern for her, but I told her we were first going to work on sleep. So I don't recommend estrogen for everyone. That's really what the purpose of my book was about. I used to, over the past 15 years, get so many people who would tell me, because of that Women Health Initiative study that was interpreted wrongly, the estrogen wasn't given to perimenopausal women. They saw initially when they were giving estrogen to women in the perimenopausal years, they saw, oh my goodness, these women are not developing dementia, they're not developing heart attacks. How about we give it to other people, not perimenopausal, an older cohort, to see if it will protect them against heart disease and dementia. And in that group, they found that no, it did not protect the older women against heart disease, and that is why the study was stopped. But the study was for testing something completely different. However, because of that, a lot of women have been coming to me over the past 15 years saying, I do not want estrogen, I want something else. And that was the purpose of my book. So in my book, I talk about all the different symptoms of menopause and things that you can do that are evidence-based. Is it, is this better? Okay. My books specifically talk about all the herbs and everything that is evidence-based to improve your quality of life for different symptoms. So alphabetically, I go through all the different symptoms you might experience, and I also discuss all the herbs that you might find beneficial. So when I spoke to Heather, I recommended that how about we treat her sleep first and we put her on estrogen, and she said absolutely not, because of the fears that many of you are aware of. And her specific fear is she didn't want breast cancer. I then explained to her that her risk for breast cancer, bigger risk factors, would be drinking alcohol, not walking, not getting your steps in every day, or being overweight. And when she realized, we really looked at the data and at the research, and when she realized that those things are really bigger risk factors than estrogen for breast cancer, she was comfortable to go onto estrogen. So we have a lifestyle clinic. And I'm so happy to know that there's going to be a health coach talking to you after. When I see people, I don't see women, perimenopausal women, as just being estrogen deficient receptors. I see them as a whole being. So at our clinic, we look at all the other lifestyle factors. We look at how you move, how you eat, how you manage stress. What are the other things that's happening in your life? So everyone who signs up for a membership at our clinic do sign up with a health coach. And as I gave her then estrogen, I also gave her, and estrogen can be indifferent, your doctor will personalize it for you. Estrogen can be, as Dr. Judy mentioned, it can be in the form of a pill, it can be in the form of a patch, it can be in the form of a gel. Everyone is different, the dose for everyone will be different. For her, I gave progesterone as well to protect her uterus, and the progesterone also had the added benefit of helping her sleep better. For her specifically, I did CBT for sleep. There is a whole chapter in my book, and I have blogs on my website. I have YouTube videos on what CBT is. It's something that is it's a form of psychotherapy that's very helpful through the menopausal transition. So we were doing CBT as well. And after a month, she came back and she was sleeping great. So she did other things. With her health coach, we talk about that your optimal sleep is between 10 o'clock at night and 2 o'clock in the morning, to make sure you don't have any screen time just before bed, that you don't have any electronics in your room, that you keep your room for sleep and for sex, that you get adequate movement, that if you do get up in the middle of the night, that you don't look at screens, that you keep your circadian rhythm the way it should be, get exposure to daylight, and a health coach is really helpful by looking at you, what you need, taking you by the hand. After a month, she was sleeping so well, she was brave enough to have sex. But then she came back to me saying that having sex was painful. Her systemic estrogen therapy was not enough to keep her vagina plump and moist. So I prescribed for her vaginal estrogen therapy. I prescribe vaginal estrogen therapy for women up to 100 years old. When I admit people to the Oakville Hospital with recurrent bladder infections, if they're in their 80s, in their 90s, and because of the vaginal skin getting so thin, you can get bladder infections more often, more easily. If you're immune compromised, if you're 90 years old, that bladder infection can easily lead to urosepsis, which is infection of your whole body, and you can die from that. So we very commonly give vaginal estrogen. We typically, for women in their 90s or people in long-term care, would give it in the form of a suppository, because that's easy for a nurse to insert. You can insert it yourself in a cream, in a suppository twice a week. It thickens the vaginal skin. It typically doesn't have any levels detected in your bloodstream, so it won't help with hot flashes or brain fog or the other things that you need. But to just, it helps your vagina quite a bit to make your vagina more plump. Your vagina needs other things as well. It needs to be moisturized. So the same way that you moisturize your face and you put body butter on your whole body, you need at least 3 times a week, you need to moisturize your vagina. It's not a lubricant that you use during sex, it's something else. You can buy it over the counter, you don't need a prescription. There are very good ones with hyaluronic acid, but 3 times a week, when you get out of the shower, I recommend that you put a good vaginal moisturizer and just moisturize that area. Then with sex, you will need a lubricant. So that is quite important to understand, that it's not something to be shameful of. For about 60% of women in their 20s in my clinic do need extra lubricants. There's a lot of lubricants out there that really changes the pH of your skin. So if you're not working with a doctor or a health coach that can tell you which lubricant, the safest to use is coconut oil. You can buy coconut oil that doesn't have a fragrance to it. They call it like fragrance-free coconut oil, so you don't smell like you're cooking. And you can put it in a nice jar, so you don't have a tub of coconut oil, you know. You can put it in a little beautiful jar next to your bed. I've never had a patient with a negative reaction to coconut oil. So that's really a very good lubricant to use. And it is true, a lot of men are worried about vaginal estrogen and they are worried that they're going to grow boobs. They are, which is a valid fear. Okay, so a very good lubricant to use. Yes, and the vaginal estrogen we give is never to be used as a lubricant. It's completely separate. Okay, so coconut oil. So those 3 things we do need. Then, a good month or 2 later, Heather came back to me and told me, now she's sleeping great. Her vagina is feeling beautiful. She had a look with a mirror at her vagina. There's no tears. Sex is not painful. But she doesn't feel like having sex. She doesn't have a libido, and she felt quite guilty about that. She has a great husband. He wants to be intimate. She just doesn't feel like having sex. So if there's any of you who don't feel like having sex, I don't want you to feel guilty about that. That is quite important. So it is very natural in the beginning of a relationship to feel like having sex, to think about sex, to buy yourself sexy lingerie and to think about sex all the time. Then very naturally later during a relationship, your libido will decline. It happens to everyone and it is very, very natural, and it is good. If we were to have sex all the time, we would not have been able to organize events like this or run companies or be successful in life, right? So that's okay, that's okay. I then spoke to Heather, and you know, quite often when people come to me for low libido, the first thing they want is testosterone cream to increase their libido. I'm not against that. I prescribe compounded hormone therapy all the time. I do prescribe testosterone. But it's never, testosterone cream is never ever a magic fix that's now going to make you want to have sex. And quite often, men comes to me where the wife would be my patient, the husband would be my patient. They both come and seek something for the libido, but they don't know the other one came to me. And I feel that is quite profound. It is so important for us to be able to discuss that with our partner, that we are in a certain phase in our life where we want different things than what we wanted 20 years ago. Our bodies are different. It's important to understand what your body enjoys now. Whatever you enjoyed in your 20s and your 30s for sex, you won't enjoy in your 50s and 60s because your body has changed. And it would be very hard for your partner to know how to give you an orgasm if you can't give yourself an orgasm. So it is very, very important for us to understand our own bodies and to understand what we enjoy in our bodies. What I asked Heather was if she was to be in an island, St. Bart's, a 5-star Mexico resort for 2 months with no responsibilities. Say she had someone at home to look after her parents, look after her children, run her business, and she and her husband could go for long walks on the beach every day and have candlelit dinners, dance under the stars. would she want to have sex? And she was like, oh sure, she would want to have sex. So then her problem is not really a testosterone deficiency. Her problem is stress, and how do we manage stress? And how do we think about stress, about sex? Good sex does require time, like anything else in life. Anything that you want to be good at, that you are passionate about, does require time. And then the next thing is, if you acknowledge that it does require time, no one feels sexy if you have been in your sweatpants all day, cooking, cleaning, folding laundry. In your bedroom there's a dog in the bed, and there's kids banging on the door, and there's a pile of laundry next to your bed. That is not, we often say that a woman is like 100 candles that need to be lit. You'll have to have that discussion with your partner and say that I want to be intimate with you. It is a priority. Because it is a priority, I want to be intimate with you this Saturday. To be able to be intimate with you this Saturday, we'll have to talk about money and problems and finances in the week, do the laundry in the week, do everything else in the week. On Saturday, I'm going to take time for myself. I'm going to have a bath. I'm going to light candles. We're going to listen to good music. We're going to have an intimate dinner together. It is something that you need to plan. And then the next thing, sex also changed for your partner, whether your partner is female or male. Men, same way that the vaginal skin gets thinner, the penis does get smaller over time. In their 20s, a man can just look at a naked woman and get an erection. When a man is 50 or 60 years old, he does need physical stimulation of his penis in order to get an erection. And that's okay, but it's so important to have that conversation, because men very often, when they come to me, they are so ashamed of their decreased ability that they are reluctant to have sex. So it's so important to have with your loved one, to be able to have that discussion. My goal for each one of you is to sleep better and to have great sex. When you go through menopause, the next half of your life is ahead of you. And there's no reason to stop having sex suddenly at 50. I have patients who in their 80s still have very, very good sex. And then on Judy's, I just want to mention where you said about 5 years of hormone replacement. I have people in their 80s and older still on hormone replacement. It used to be, we used to say only 5 years, but now that we have such good data showing how safe it is, there's a lot of women who want to stay on it for other protective factors, for their bone health, for cardiovascular, for Alzheimer's prevention. And although it's not a primary indication to prevent Alzheimer's disease, we do know that these women who has been on estrogen for longer does not develop Alzheimer's disease as easily as their cohort who are not on estrogen therapy. So our guidelines are now changing, saying that we can leave women longer on hormone therapy, and I do, and they do so well on it. That being said, you don't have to go on hormone therapy. There are so many other things that you can do. All of them are in my book. I really recommend. We ran out of books, but you can easily, if you couldn't get a copy tonight, get it on Amazon.ca, and all the other things that help with brain fog, decrease libido. All the herbs are there. My desire for you, with or without hormone therapy, is to thrive through life, to sleep well, and to have a great sex life, and to know that you can have it all. Thanks for coming. I am not going to stay the whole night. I just returned from South Africa, where I attended my brother's wedding. So I'm still on South African time, which means it's like 3 o'clock in the morning for me now. So I might not stay until the Q&A. However, everything you might want to ask is on my YouTube channel. If you want to take out your phone and have a look at if you don't have the YouTube app, you can just look on your browser. If you open YouTube, and you'll see there Dr. Daniela Steyn. It's DR for doctor, DR, then Daniela, D-A-N-I-E-L-A, only one L, and then S-T-E-Y-N. If you subscribe, then you'll get an email every time, or I think a notification every time there is a new video. There's a wealth of information. Anything you might think of asking me is on there. Thanks so much.
I want to ask right now, but luckily take a couple of questions from the floor, because after this we have a quick chat from Mark and then a bit of a break before we get to the second half. So if anybody has any questions for Daniela now, that you're brave enough to ask, please feel free to go ahead.
A question I get all the time is, do you need a referral? So the majority, yes, you can get a referral from your doctor. Unfortunately, OHIP only covers one visit every 24 months. I'm double board certified. I'm certified through the American Board of Lifestyle Medicine, so we have a lifestyle medicine clinic. And I can see you for one visit. If you really just need one visit, I would still love to see you. Or if your doctor doesn't want to give you hormone therapy, I would love to see you. I can give you hormone therapy. Typically, in my experience, it's not just only hormones. In my experience, women are so much more than hormones, so we typically need, that's why everyone who comes to my clinic does see a nutritionist, maybe signs up with a trainer, does see a health coach, because we want to journey with you, we want to support you. And then I'm also certified to do psychotherapy, which specifically works on all the other things, on your sleep. A lot of people develop some anxiety, some irritability. And how do we manage these big emotions? Very similar to when you go through your teenage years, your brain is literally rewiring itself. So you might be experiencing big emotions that you're not used to. Some women would have been very level-headed, steady, and suddenly they get mad or angry or mad at the way their husband chew, or things like that. And then for that you don't necessarily need hormones, but psychotherapy is very helpful for that.
For you or for the husband?
Thank you so much. I appreciate your time. I know all of you are very busy. Thank you so much.
Well, that was awesome.